Welcome to Honest HR. I'm your host, Marjorie Morrison. Today, we're taking a closer look at virtual healthcare and how HR teams can leverage it to maximize the value of their benefit offerings to enhance employee well-being. Joining us is Tira Gunlock, CEO of First Stop Health, a company that offers virtual medical and mental health services. Welcome to Honest HR, Tira.
Thanks so much for having me, Marjorie. Delighted to be here.
I'm excited for this conversation. So let's just get started. With your take on the state of health insurance today, what are some of the biggest challenges employers face in offering their workers quality healthcare through traditional benefit models?
So the two-word description that I often use to describe the state of healthcare insurance today is a hot mess.
I love
I'm going to guess that you probably want more than two words. So I'll go into a little bit more detail. From an employer perspective, I think they're just swimming in this kind of point solution soup. So on average, most employers have between 4 and 9 point solutions, which is a lot to manage. A lot of those are getting not a lot of utilization. So HR teams are spending all this effort trying to find valuable solutions and then rolling them out. And then instead of the, cheers and jeers of, high utilization, they're seeing less than 20% on average. And so that's certainly a lot to kind of contend with from a, cost and kind of confusion and standpoint. But to kind of double click on the cost aspect, I think that is another huge issue that employers are contending with. So, costs are rising dramatically, still 8 to 20% every single year, way outpacing inflation. They've risen 50% in the last decade alone, which is just like one of those things where it just makes you just gulp. And then the one thing that I think is just so staggering when you think about costs, because this is, I think, just hard to imagine, is that out of every healthcare dollar that we spend in America, 30 cents is on administrative costs. And so when you translate that to what an employer spends, they're spending $2,500 to $4,500 on every single employee every single year on just the administration of care. So it's like, that's not even the care, right?
Like a lot of people have plans, right? A lot of people are collecting things along the way.
Yeah, exactly. It's like there's a lot of paperwork basically being shuffled around, right? And that is what that represents. And so it's about $1 trillion basically every year in paperwork. So, and it's largely due to the fee-for-service kind of claims adjudication, health insurance industry that we've kind of relied upon for so many years. And so that's just kind of the employer perspective. If we get down to the employee perspective, right, there's long wait times, typically over a month for a new provider, which is, I think, probably conservative depending on the area that you're in. There's, wait times issues that are compounded with, people trying to find the right provider. The majority of Americans don't have a primary care provider at this point. And then, of course, I think healthcare just feels too hard. So I think one of the biggest beefs that I have is that I think healthcare just makes people feel dumb. And I don't think people are dumb. It's like it makes the average person feel like an idiot. And so I think that there's just so much opportunity for the right solution to come in there and make people feel empowered and get them the right care with simpler solutions.
I love that, and I couldn't agree more. And I appreciate you putting that into a way that's so relatable. I'm just curious, like, you're in telehealth. So how have you seen telehealth and telemedicine kind of reshape over the past few years? I mean, it was maybe always a thing, and then COVID came and it was like, whoosh.
Yeah. Tidal wave of adoption. Yeah. I know it was a wonderful thing. I think so at First Stop Health, we've always kind of prided ourselves on having great adoption, but I think it did, certainly the pandemic opened a lot of people's eyes to the possibilities of virtual care. And that was, I think, perhaps a silver lining for that adoption. And so I think, we're at this point now where pretty much, I think it's a given that all employers have some kind of virtual care, some type of service, but whether or not they actually have employees using it and having it be their kind of go-to for, every time they have a UTI or every time they think about some sort of issue, I think that's where there's still probably quite a bit of opportunity to seize for a lot of employers, and where they're kind of looking for, ways to assist in that. Because honestly, that's where that's where the benefit is really realized. Another thing that I'll add too is that a lot of times telehealth solutions, in and of themselves, it's just a mode of delivery, right? And a lot of times they're still operating within this system still of bloated paperwork. So it's like, there's a couple of analogies that I'll use. One is it's like ordering DoorDash, but the driver has to fill out a triplicate before leaving the restaurant. So it's like, you're living in the future, but you're really not. And so I think a lot of healthcare still kind of lives in that world where on the surface it feels high tech, but behind it, it's still just very inefficient. And so what we're really trying to do is to try to eliminate that unnecessary noise and deliver, value at the point of need.
Yeah, that's an excellent point. And we're finding it too at SHRM. SHRM just released its 2025 employee benefit survey, and nearly 4,000 HR professionals that were surveyed. We found that 91% of their employers offer some form of telemedicine or telehealth services as part of the benefit packages. So it's like there is a huge amount, 91%, that are offering it. But the question's like kind of why? Like, why should organizations consider it as part of their benefit strategy? And I guess from your vantage point, what unique value does it offer compared to traditional care models? And I think my question is maybe for in the bigger realm of you mentioned the UTI, can they measure it or track it, or do you still have to go in to CVS and get the thing, or how does that? What's the value prop?
Yeah, I think what I love that you use the word kind of strategy in there, because I do think that virtual healthcare is not just convenience. I mean, it's certainly convenient, right? But it is truly, I think, a strategy for reducing your costs, for faster access, for a better employee experience, for lower wait times, for a lower cost of care, for all those different types of things, right? If you think about, for a shift worker, right, who doesn't have to call out or miss a shift because they just needed to go in to get a simple prescription, right? These are hugely meaningful returns for that employee or for that employer, right, who didn't have to lose an entire shift of productivity for that employee. So whether it's an avoided ER visit, which you avoid one ER visit for a simple issue, it is huge returns. And so, yeah, those things are pretty easy to track, right? In terms of asking people what they would have done had they not used virtual care. And they will tell you they would have gone to an urgent care. They would have gone to an emergency room, and what those average costs are. And so those are pretty easy things to track. And at this point, from a clinical effectiveness perspective, we have clinical guidelines on how to treat things and when to refer in for various, issues, right? Telehealth is still, I would say, a conservative practice. So if a doctor thinks that they need to be seen in person, they will refer them, right? But there's pretty, I would say, sophisticated guidelines at this point in terms of how to treat various ailments.
Tira, I'm curious, when you think about HR and HR teams, if they're considering a virtual healthcare option, what are some of the most important questions that they should ask to determine whether or not it's the right choice for both their business and for their employees?
I think, so I grew up on a farm. And so one of the things that it was not just a saying that, that people say, was actually said on the farm that I grew up on, which is you measure twice and you cut once. So we were fixing things. So I would say, you really do want to understand the problem that you're trying to solve. So asking, are you trying to really amp up your employee experience, use it as part of your retention story? Are you trying to improve productivity? Is it claims costs that you're really struggling with? And if so, what type, right? Are you seeing unnecessary ER visits explode? Are you having a lot of chronic disease in your population? If so, what type? And so that should steer, not just kind of what type of solution you choose, but also how you roll it out, the messaging. And then I would also add that when you roll out those types of solutions with your population, and when you've rolled out historical, solutions with your population, looking at if you've had success with any sort of kind of point solution or any sort of benefit, if it was well utilized and well loved, what were those things that made it that way? And if it wasn't, what made it that way? And so doing kind of a nice retrospective, I think, is always a good exercise because I think it will highlight basically where there's some room probably for the right solution.
So then, like, following up on that, for the times where there are barriers, let's just say, have you seen any common ways to overcome those barriers?
Yeah. So I don't know if you've heard, does the name BJ Fogg ring a bell at all? I don't know if this is a mainstream name. Well, maybe like totally off base.
It probably is, and I don't know it. But I learn something new every day, so this might be my Actually, I already learned something new today, so this might be my second thing I learned today.
Oh, great. So he's this researcher who talks a lot about behavior change. And so which I think he has just like a really like nice kind of simple model, but he breaks it down by saying that behavior change happens when three things converge, and it's motivation, ability, and then we'll call it just kind of messaging or prompting, reminders, kind of that kind of category of things. So those three things have to collide, right? So if you think about telehealth, so motivation is high if somebody, if they feel sick or itchy or stressed or, anxious about managing a chronic condition or, fill in the blank, right? And ability depends on how easy that telehealth solution is to use. Can they access care in seconds? Is it free to use? Do they have to pull out a credit card? Does it take 17 downloads? All those types of things. And then the messaging is, are they getting the right type of personalized messaging along the way? And so if you're thinking about kind of when they're seeing barriers and like to adoption, or when they're kind of running up against these things, it's probably in one of those three buckets. And what I've generally found is that a lot of telehealth solutions only actually tackle one of them, and it's within messaging. And it's like, oh, let's just throw more messaging at it without actually looking at the ability, right? And so we've tended to try to focus a lot on the ability aspect so that when it comes to messaging, it actually doesn't take much. Right. So you actually don't need as much messaging because you've made it so easy to use. Because actually a lot of people are pretty motivated when they, get bitten by something in the middle of the summer or what have you.
Yeah.
But it is one of those things, like, I think it's a really helpful model to kind of understand when you're faced with people not using something. It's like, okay, maybe it's not just this message. Maybe it's somewhere else in this equation that we might be missing the mark.
Does it seem like messaging is the key piece to encouraging people to use it?
I mean, it's one of the three, right? It's between those types of things. And I think, and even within the messaging components, it has to be like, it has to be personal. It has to be at the right time and all those types of things. But if it's not easy enough to use, you could like message till you're blue in the face and it's still not going to get you there. Right. And so that's where I think a lot of times things have fallen down because there's been so much friction. And I mean, just within healthcare generally, right? It's like, think about how much friction there is for just your regular, appointment that you've kind of got, your regular doctor that you've been seeing for years, and how much friction there is there. So yeah, that's where I think there's a lot of general improvement needed within the system.
So going back to your farm analogy of measure twice and cut once. I've heard that in like upholstery or something. But like thinking about measure, I love that analogy too, which is like really take your time and think about really what you're measuring, right? Make sure you get it right. So how do people measure it? I'm sure that there are ways, like you mentioned it earlier, the stuff is measurable in the sense that you could see utilization, you could see ER visits go down. Are there other things, or have you found when you're out talking to employers that you're like, this is how I want you to measure the success of First Stop Health or something like that?
Certainly. So I would say most of our clients that we work with care, I was probably predominantly about utilization, how many people are using the service, how many visits are occurring. They care a lot about savings, which we can track. A lot of folks care about hours saved, right? In terms of missed work or just like time in general, right? There's a lot of different ways to measure wealth in the world, but time is certainly one of them. And so I think that's an important component. We also measure, Net Promoter Score. So, I always try to steer clear of the word patient satisfaction because I'm always like, well, we should be more than satisfied. Patient experience, we'll say. So, measuring net promoter score. And so we aim to have, I think right now we're tracking at plus 85 right now for the year. So we really try to aim to have this memorable patient experience, because that word of mouth really means a lot to build up trust and adoption, going back to the utilization metrics, right, over time. And so that there's a lot of metrics depending on what that client's need was that they're trying to solve for in terms of what they want to track.
I think that makes so much sense. And it's so good that we now can track these things. I want to kind of like pivot over to mental health, my box of what, I've spent my year in. And I'm so happy to see how much access has been transformed really through mental health. And, some people, I hear people say, no, I want to be face to face. But you know what? Most people find that it is incredibly convenient, and that it doesn't really change the actual, treatment type. So I'm just curious, as you've been in this telehealth space over the past few years, and it sounds like maybe, are you guys doing telemental health, and like, how have you seen it change over time?
Yeah, so we rolled it out initially in 2020. So, which I think was probably
right in COVID. Great
not
time.
stressful at all. Nobody needed anything. So, and we saw a great, obviously, adoption with it. And then we rolled out an additional product in January of this year, a more fulsome offering with long-term support. And we've seen great adoption with that as well. I think where we're seeing, we saw over 30% utilization. We have, I think so far in the first 6 months, 74% of folks that are reporting a higher sense of purpose, 66% reporting reduced risk of alcoholism and tobacco usage. And so we've seen like really substantial results even within the first 6 months. And so just goes to show that if you solve the access issue, people are motivated to actually get the help that they so deserve.
So what was that new product? Like, how did that, how did it augment what you're already doing?
So initially, I would say what we tried to solve for was a high usage, amped up EAP, basically, right? So EAPs are, I think, fine from a design perspective, but they weren't being utilized, right? And so, but they're short term in nature, and that's what our product was, right? It's kind of short term, kind of goal oriented therapy, and that's what our product was initially, which does solve a lot of issues. What we wanted to provide was a more fulsome offering, right? So longer term therapy and counseling for higher acuity, also some, prescription therapy if a patient, warranted, or if it was warranted. And so, but yeah, it's been a great success so far. And I think it's nice to be part of the solution.
Well, yeah. And I'm really such a big advocate and believer in whole health and whole person health. And I just feel like if you're already there doing virtual healthcare, you create opportunities for access to have conversations about mental health, and you're taking the friction away, to use your word, to make it easier for people to access it. So I really appreciate that you've expanded in that. I mean, at SHRM, they did a benefit survey, and 88% of employers offer some form of mental health coverage. But the thing is that it's different for everybody, right? Like you mentioned, high acuity, we have our low acuity, which is our coaching. We have a little bit longer term therapy. We have, our more disabilities. I'm just curious, have you seen, partly, I'm guessing that you built this product because you were getting feedback from the employers, but have you seen any trends or themes from employers around it?
In terms of acuity?
Well, just about like what they're looking for, and as far as for benefits, mental health benefits with telemental health.
I would say, I would say the genesis of us entering the mental health market was, hey, we've seen you guys be successful in getting people to use virtual care. We know our population needs help with mental health. Can you do this too? Like that was kind of the genesis of us entering that. And so, which I think we have been successful in doing that. And I think it's been really about replicating some of the things that worked for us on the urgent care side of our work, which is making it as easy as possible to use. So not making it 45 steps from an intake perspective, right? It's like, let's get you screened as quickly as possible. Let's get you in for your first appointment, and then go from there. And so I think trying to break down those barriers is super important. And still, I think employers are still probably going to want more year after year, right? It's like it's going to become an increasingly important, I think, tool just for maximizing productivity alone, right, for their employees.
Yeah, I mean, we do a lot of work in the collaborative care space, and I feel like you're sort of dancing in that providing, both of those things. So when I think going back to HR, we're talking a lot about burnout. We're hearing a lot about burnout. I'm talking a lot about burnout, right? And really kind of going deeper into that, like not just what it is and, why it is, but really how can we get to the root of it? Same thing, SHRM has the civility campaign, right? How to have more meaningful conversations around conflict. So when you think about conflict and burnout, I would think that all of these things would also help HR. Do they see that as a connection, or do they see it separately, that these are just an employee benefit to get the mental health for their personal reasons?
Oh, I think there's certainly, yeah, they certainly see it as a tool, right? I think, but I will also say that the most progressive employers see mental health and their strategy around mental health as more than just offering one solution, right? That it has to be a cultural shift. And we certainly love to be part of that. But, if you look at what the World Health Organization has these, just incredibly like nightmarish statistics like $1 trillion lost per year on productivity due to mental illness and all these types of things. And so, when you look at those, it doesn't take much to, I think, convince employers or for HR teams to convince their CFO to say we should probably just invest a little bit more here. And a lot of employers too are struggling even from an ER expense perspective, where a lot of mental health conditions are winding up in the ER if they're not dealt with earlier.
Yeah. I'm thinking about kind of where you started by talking about this like bombardment of point solutions, because I couldn't agree with you more. I'm so happy of all these solutions because so many of them are so innovative, but it's hard, I think, for an HR person who's just, getting exposed to all of this. And, I find that all of them, I haven't met one yet that hasn't spent so much time really thinking and analyzing and working on what are the best benefits for their employees, right? Like nobody's pretty flippant about it. Most of them really care. But how do they know, like, whether or not their benefits are the right match and or should they be doing more in a virtual option? How do they I would imagine you've seen it. You've been selling into this group, right? Or you sell to employers, I take it.
Mm-hmm. Uh-huh.
So have you seen it? Have you been able to kind of get a sense of how they are able to tell?
How they're able to tell if it's working or if
if it's working, and then if they should be expanding more, leaning in more into virtual or not?
Yeah, honestly, it's the best indicator of success is adoption, right? And it's revealed itself. I will say it will reveal itself pretty quickly upon rolling out the right solution. So not necessarily within 2 weeks, but it doesn't take long with the right solution to get people to start to change their behavior and to try to kind of turn the ship on adoption. And that's what will ultimately bend the cost curve on claims. So, which takes a little bit longer, in terms of seeing the cost curve bend, but ultimately it's behavior change first, cost curve second. And so that is, I think, ultimately the number one thing that most employers are kind of looking for.
That makes a lot of sense. So, we can't have a conversation about healthcare or mental health care without talking about AI, because it's coming at us at the fastest speed ever. And it's just been fascinating. I used to say that once every couple months, someone mentioned that they were using AI for therapy. And then it was once a month. Then it was once every other month. And then once a week. And now not a day goes by that someone doesn't say to me, no, I just go to ChatGPT or this or that. And so it's changing so fast. And I think that that's exciting too, because different things work for different people. But I'm curious how you see it affecting your business today and in the future.
Yeah, I would say that I think we're still at the beginning of a pretty, technological tectonic shift. So I think it's hard to predict the speed and the impact of it. So likely whatever I say, it's, 99% chance I'm going to be wrong. Just,
Everyone hold it to no one knows. So there you go.
But I think, I think we have to walk into this with our eyes pretty wide open. And I don't think that there's any AI model right now that's ready to treat patients without humans in the loop. There's period. But I also think we have to recognize, and I work with a lot of clinicians. We have to recognize that patients are already using them, whether or not we want them to or not. You're right. It's like they're already using them. And so it's a new context in which we are actually delivering care because patients are already in this new environment. And so, so it's a really interesting time. I think I generally approach AI with a pretty optimistic how might we lens, but also try to acknowledge the risk, so I think we can, hopefully expand creativity, support some human dignity, and hopefully, make care more affordable and accessible, especially as, more opportunity to, increase care for those that need it most. I think there's lots of opportunity. And ultimately, I think there's lots of ways that I would say that if we're going to do it right, there's a way to not replace clinicians and just retool them and give them better instruments to in a system that just desperately needs a lot of renovation.
To help augment the care too, right?
Mm-hmm.
If you think about maybe you're seeing someone 50 minutes, maybe every other week, can they be working with an AI something to assist them during the day? And I think about the admin, the 30% admin cost we talked about at the beginning. What about the role that AI can play, not only in the actual patient care, but in the care delivery, right? Have you guys been approached with that just in the way that you're running your own business?
No, certainly. It's that's the easiest opportunity, right? Is trying to get more and more efficient. Our kind of 3 pillars as a business, it's affordability and delight and engagement, right?
Delight?
And so affordability, delight, and engagement. And I think
that.
Yeah. And ultimately, I think AI can play a role, honestly, in all 3 of those, right? So how can we make care more affordable? How can we make it more delightful? Because honestly, I built my GPTs. I think they're delightful.
Right.
They make me happy. How can we use this information to better engage people at the right moment? And so I think there's so many opportunities, and I think it's exciting, but I also think that we have to, approach with caution.
So for our last question, I'm just curious, are there any additional trends or innovations in telehealth that we haven't talked about? Is there anything that you're excited about? Anything which HR professionals should be watching for?
I would say that I'm just very excited that there seems to be a rise in a lot of direct contracting models, and that's both within telehealth and also without, kind of beyond telehealth, and a lot of growing energy around employers kind of stepping into the driver's seat of their benefit strategy. I think there has always been a desire to do more for employees from HR teams, right? That has always been kind of the heart of HR. And I think there's now there's this growing energy of empowerment to try to go outside of the traditional system and to think more kind of innovatively and kind of trying to figure out, how can we deliver more value, more accountability, and better experiences faster through direct contracting. And I think that's super exciting. That's exciting. Innovative space.
I agree with you. We talk a lot about who's holding the risk, right? And people always say payers hold the risk, unless it's Medicaid, Medicare, that it's the payer. But really, ultimately in commercial insurance, it's the employer, especially if they're a self-insured plan, they're holding the risk. So it makes sense that they're the driver's seat and that they're kind of making those types of decisions, on their own, and they're able to, at least do what's working for them, right? And when you think about going back to measuring, if they know it's being impactful, then it should be able to be innovative with the solutions. The whole concept of being able to get your healthcare and mental health care through your employer without having to leave the office is, think about it, back in the day. That already is the future. And it's so exciting to see where it could go, because I think about what you said about you grew up on a farm. I would imagine when you went to the doctor, it was a big deal. Yeah.
It took some time.
I mean, I don't know. Were there a lot of doctors at the farm? I don't know. I mean, I grew up in Los Angeles, so, I was like a different kind of thing. But it's like you really are moving a lot of barriers. And so I'm grateful, for the company you run and these other companies that just make it easier and more delightful. So it's a great, great word. Thank you so much for being on here. And that is going to do it for this week's episode of Honest HR. A big thank you to Tira for sharing her deep insights with us. Honest HR is part of SHRM's HR Daily flagship content series. Head to shrm.org/HR Daily to learn more and sign up for our newsletter. You can also catch us on SHRM social media. Like, comment, and be part of the conversation. Thanks for joining. See you next time.
SHRM.
This podcast is approved for 0.5 professional development credits, aka PDCs, toward SHRM CP and SHRM SCP recertification. Enter the following PDC activity ID in your SHRM activity portal to log your credit. 26-XAHAK. That's 26-XAHAK. This ID expires on August 1st, 2026.